Imagine trying to breathe through a straw every minute of every day. Even simple activities like walking, climbing stairs, or carrying groceries can leave you short of breath. For millions of people worldwide, this is the reality of COPD, a condition that gradually makes breathing more difficult over time. So what exactly is COPD? COPD stands for chronic obstructive pulmonary disease. It is a long-term lung disease that blocks airflow and makes it harder to breathe. COPD is not a single disease, but a group of conditions, mainly chronic bronchitis and emphysema, that damage the lungs and airways. To understand COPD, remember that air normally travels through the airways into the lungs, where oxygen enters the blood through tiny air sacs called alveoli. In healthy lungs, these airways remain open and the alveoli are flexible, allowing efficient gas exchange. In COPD, the airways become inflamed and narrowed. Excess mucus may also build up, making it harder for air to move. At the same time, the walls of the alveoli can become damaged and lose their elasticity. As a result, air becomes trapped inside the lungs, making it difficult to fully exhale. This leads to common symptoms such as shortness of breath, chronic cough, wheezing, chest tightness, and increased mucus production. In the early stages, symptoms may only appear during physical activity. As the disease progresses, breathing can become difficult even while resting. The most common cause of COPD is long-term smoking, which damages the airways and lung tissue over many years. However, exposure to air pollution, dust, chemical fumes, and certain occupational hazards can also increase the risk. In rare cases, genetic factors may contribute to the disease. The understanding of COPD has improved greatly as scientists studied how smoking and environmental exposures affect the lungs. Today, it is recognized as one of the leading causes of illness and death worldwide. Although COPD cannot usually be reversed, treatment can help slow its progression and improve quality of life. Treatment often includes inhalers, medications, pulmonary rehabilitation, oxygen therapy, and lifestyle changes such as quitting smoking. Early diagnosis is especially important because it allows treatment to begin before severe lung damage occurs. Today, artificial intelligence is helping doctors detect and monitor COPD more effectively. AI systems can analyze chest X-rays, CT scans, and lung function tests to identify early signs of lung damage. Some hospitals use AI-powered software to measure changes in lung tissue that may be difficult to detect manually. Wearable devices can also track breathing patterns, oxygen levels, and physical activity, while AI analyzes this data to identify worsening symptoms and alert healthcare providers before serious complications develop. COPD is a chronic condition that gradually damages the lungs and makes breathing more difficult. Understanding how it develops highlights the importance of protecting lung health, avoiding harmful exposures, and seeking treatment early when symptoms appear. But COPD is not the only condition that can seriously affect the lungs. In our next video, we'll explore pneumonia explained and discover what happens when an infection fills the lungs with inflammation and fluid.